Functional electrical stimulation has been a hot topic for the treatment of foot drop. There's been a lot of published studies and research done on how it helps strengthen the muscles that cause foot drop. It is used to target the tibialis anterior muscle and strengthen it to allow you to contract the muscle properly to gain proper foot clearance during gait, which is walking. Functional electrical stimulation uses small electrical signals to stimulate the nerves in the leg, causing the muscle to contract and produce a movement that can help with walking. A functional electrical stimulation device consists of a control box that's about the size of a pack of cards, which is either worn on your leg or on your waist. Connected to this control box is a sensor that's worn in your shoe, which is called a heel switch, which detects pressure changes as the foot starts to move. Then electrodes attached to the skin below the knee apply the electrical signals to the leg, and if you have foot drop, these signals can, for some people, help lift the foot to the correct angle for taking a step and prevent it from dragging on the ground. Research and experience has shown that treatment with functional electrical stimulation produces a more normal walking pattern, enabling people to walk faster, further, and with less effort. It can also help build confidence in walking and increase independence, as well as reducing the risk of trips and falls, which is very important for you because we want to help you be able to have a normal walking pattern and to be able to walk around at your normal pace with less effort, and to build confidence in your walking so that when you're walking around, you're not worrying about tripping and falling, and you feel balanced and your foot's not dragging across the ground that can get tripped up on uneven surfaces. So what does it feel like? So the electrical stimulation causes a tingling, which is like pins and needles or buzzing sensation on the skin. Ensuring that the wires and pads are in the correct position can help minimize some of these sensations. And for most people, this is not a problem, but some people will find the effects uncomfortable and may not want to continue using it. So what does the evidence say? So looking at an article with the title "Novel Patterns of Functional Electrical Stimulation Have an Immediate Effect on Dorsiflexor Muscle Function During Gait for People with Post-Stroke." This article discusses how FES can affect the swing phase of gait in patients demonstrating foot drop post-stroke. The results of the study were that FES improved ankle dorsiflexion during the swing phase of gait. FES stimulation used both a constant frequency and a variable frequency. So one, it's gonna send a frequency the whole time, and one, it's gonna change intermittently. Helped improve ankle dorsiflexion during the swing phase gait compared to without one. So the evidence suggested that it can help produce a more, normal walking pattern, which is ultimately like what we want to help you with. And I think that with the proper rehab and the proper strengthening, that we'll be able to get you back walking and getting around like you used to, and you won't be having to worry about tripping and falling. And the only real weakness of the evidence is that it was only used for a small number of people, about 13 people, but we know that the strengths outweigh the weaknesses in that it has actually been proven to reverse your foot drop.